Dr. Francesco Montorsi is here now talking about excellence in urologic care. This is a rather broad term, so tell me a little bit about your talk and specifically what you mean by excellence in urology.
What I mean by excellence in urology is to give our patients the best possible care, which is not only surgery, it is not only the results coming out from an operation, but is also being empathic with patients, making them as happy as possible, not only themselves, but also the families. And there is not only one ingredient to reach this target. There are many things involved. And in my talk, I discuss the value of mentors, because we can choose our mentors during our career. I'm saying we cannot choose our parents, but we can choose our mentors. And that is important because a mentor is somebody who is helping you to explode your qualities, to become a better person in your career. So that is one thing. And then also being very humble. Go visit the others because you want to learn new things. And it is important to recognize that there are others who are better than yourself, at least at the beginning of your career, and you want to learn from them how to improve. The concept of the learning curve, for example, is important for those who know their results. I'm talking specifically for surgery. If you know your results, you know what you are doing bad and what you are doing good. If you know what you are doing bad, you can improve. You want to change things. You want to change your surgical techniques, for example. And so it is a never-ending journey to be as good as possible.
So you have some marching orders. What do you think the biggest challenge is right now to being able to achieve that?
I think that the biggest challenge is to be humble enough to recognize that at least at the beginning we are not perfect and we can do something better. And even more important, once you think that you have reached a top level, be humble again and say, I can do better than this. So in a way, it's good to be happy of what one is doing, but I think it is important also to be on the other side and tell ourselves, yes, I have done something good, but most probably I can be even better than this. So find good questions, which is the first step. It is not easy, but then having the will to find the best answers.
When you talk about surgery, it's something that is easily practiced, a skill that is gained. When you talk about empathy, it's not quite that simple, is it?
That is true. Empathy does not come by itself. But indeed, again, let me restate one more time that humility, being humble, is important, because one also, if you are clearly the number one in one field, feeling himself or herself being like an emperor is not good. So we are here to help patients and do all we can to improve their lives. So there are always things that deserve to be learned.
You talk about this idea of helping. If someone doesn't have a mentor, what are other resources that they can look to?
Well, I think that it is difficult not to have a mentor today, because a mentor is not necessarily somebody you see every day or you work with. You have examples all over. Reading books, reading newspapers. We are exposed to life 24 hours a day, and it is important to see what is going on outside, in the outside world, and then asking ourselves, what am I doing to do as good as I can? So there are no excuses.
That's a great way to end it. There are no excuses. Be excellent. Looking forward to your talk. Thank you so much, Dr. Montorsi.
Thank you very much.